Moderna has just released the first analysis of its coronavirus vaccine, and it is very promising. The company says the results of its phase 3 trial show that their vaccine is 94.5% effective. That's even higher than what we'd heard of with Pfizer's vaccine. This is huge. Our experts are being scrambled into position so that we can break down all the details for you in just a moment.
Let's break it down now. Let's not wait just a moment. This is a huge deal with record hospitalizations and more than 100,000 new cases for the last 13 days. So let's get right to Elizabeth Cohen for this truly stunning news. Elizabeth, 94% effective. Now we have a second vaccine providing so much hope. Tell us what you've learned.
John, indeed, these numbers are stunning. Pfizer's vaccine showing very similar results. Let's get right to the details. As you said, let's break it down. What this Moderna data shows is that they gave 15,000 people a placebo. That's a shot of saline that does nothing. 90 of those people became sick with COVID over the period of several months. They also gave the same number of people the actual vaccine. Only 5 of those people became sick with COVID. That is where you get that stunning 94.5% effectiveness. Now, not only that, but the vaccine protected against severe illness. Those 5 people who took the vaccine and got sick, none of them became severely ill. But of the folks who got the placebo and got sick, 11 of them became severely ill. Also, good news on the safety end of things. A small number of people had things like headaches or muscle aches after receiving their 2 doses of the vaccine, and it is a 2-dose vaccine. But there was nothing severe, nothing terrible happened. Now, this is news to us, and yesterday it was news to Moderna. An independent panel called the Data and Safety Monitoring Board analyzed these numbers, and they told Moderna about these results yesterday afternoon. Let's take a listen to the Chief Medical Officer at Moderna, Dr. Tal Zaks. Tell me, how did it feel to hear that number, 94.5%?
Elizabeth, it's one of the greatest moments of my life and my career. It is absolutely amazing to me to be able to develop this vaccine and see the ability to prevent symptomatic disease with such high efficacy.
Now, neither Pfizer nor Moderna has applied to the FDA for authorization on its vaccine. They can't do that quite yet. They need to accumulate some more safety data, but that is expected to happen very soon. I spoke yesterday with Dr. Anthony Fauci. He said that he thinks vaccinations could begin in the United States in the second half of December. Allison, John?
Second half of December, which is really just a few weeks away at this point. But talk to me about the distribution pattern, Elizabeth. What is the plan, really, for both vaccines?
Right. So for both vaccines, it's the same, John. Not everybody will be able to get this vaccine at first because we won't have enough. So there are high priority groups, elderly people, healthcare workers, people with underlying medical conditions. They will be first in line. And that's who's expected to start getting it in December. Dr. Fauci said other people who are not high risk, he doesn't think they'll be able to start getting the vaccine until, he said, the end of April. And he said it will take months. He said May, June, July. It'll take months to vaccinate all of those people.